Okay, everyone, let's talk about medication safety. So, every facility or every company that you work with will have their own different, pretty much, policies and procedures. Especially as a home health aide, a homemaker, a home caregiver, there is a portion where we may not be the ones allowed to be able to touch this. We are going to be there possibly to provide reminders for the client, for the patient to take the medications. Typically, there's companies out there who are just homemakers, and we cannot make any suggestions about the care. So we're just there to really give reminders. But it's always good to brush up regarding medication safety for clients. So that's what we're going to be doing in this portion right here. So we want to be able to list four guidelines for safe and proper use of medications. We want you to know that people who need home care often need medications. Home health aides do not usually handle or give the medications. However, you need to understand, and that's why we're here. Like I said, we need to understand the kinds of medicine your clients may be taking, and you should have an idea and need to know what to do if a client experiences any side effects or refuses to take the medications. Remember, we're caring for the clients so that they can stay longer at home. And so, one of the biggest reasons why patients end up in the hospital or assisted living or in nursing home or long-term care is because they are non-compliant with their medications. So let's look at some of the guidelines for the use of the medications. Never handle or administer medications unless trained or assigned. But pretty much I can guarantee you if you're a home health aide, a homemaker, a caregiver, then you won't be allowed to do this. But you do want to observe the client's self-administration of the medications. Are they taking it? Are they using it properly in a way? Know the differences between any prescriptions and over-the-counter medications, and also be aware of all medications that a client is taking. In addition to the guidelines listed that we put on the last slide, remember you need to know the following for safe and proper use of medications. You never want to touch the inside of the medicine bottle or the pills because then you contaminate it. So, I'm sure that you've done it in the past where you are trying to get some Tylenol or ibuprofen from a container and you reach in there with your finger. That's a no-no. You shouldn't be doing that. You should pour always whatever's inside into the cap and then pretty much hand pour it to your hands what you can use and then replace it back. But you never touch the inside of the cap, never touch the inside of the bottle. You always want to remind the patients or the clients to take their medications. You want to be able to bring medication containers to the client. You want to be able to provide the food or water. Want to be able to make sure that you observe, report, and document what is going on. And then if there's any side effects that you're noticing, are there any interactions or any symptoms that's occurring like itching, trembling, or shaking, or anxiety, stomachache, diarrhea, confusion, vomiting, rash, hives, or even a headache? These are symptoms that shows a person is having a reaction towards a medication that they're actually taking. I want you guys to remember and knowing and remembering that 5 rights of medications will help prevent mistakes. Right client, right medication, the right time, the right route, and the right amount. Is this medication really for this person or is it for their husband or their wife? Is it the right medication to be taken? Are they taking it at the right time? Are they making sure that they're actually taking it? Is it by mouth? Is it rectally? Is it topical? Is it sublingually? Okay? Are they using it correctly? And also, are they getting and taking the right amount of dosages? This is important to know. You want to be able to know the rights of the medications. This is for you as a person and for your family, but this is, of course, for your client and your patients as well. The right client, check the client's name on the label. Right medication, check the name and the medication, and especially expiration date. Expiration date is something we need to look in as well. Right time, are we giving it the right time? Is this a pill that they're supposed to take in the morning before they go to sleep? Are they supposed to take this only as needed? Okay? You need to be able to know these 5 rights. Medications will have labels that list instructions for how much and when to take the medication, as well as how to take the medication and a maximum day limit. So those are for the as-needed basis medications. Always look and read the instructions and help the client if they cannot read it fully. A lot of elderly people, a lot of seniors out there have that hard time remembering to take all their medications. So in addition, there may be instructions to remember things. So that's why your facility is there to help remind them. So typically a lot of caregivers, a lot of homemakers, a lot of home health aides were there to be able to remind them to take their medications, okay? So some of the roles of a home health aide could be reminding the client to take medications, looking at the 5 rights, helping with reading the labels, bringing the container to the clients, bringing any needed equipment. Let's say, for example, it's a breathing treatment. Okay, do they need to take this medication with food and with water? Do we need to shake it for them? The pretty much it's a suspension, and we need to shake the suspension for them before we actually pour the medication or have them pour it. Do we have to open, close the containers? Do we have to help position them? Do we need to sit them upright? Do we need to transfer them from bed to a chair so that they can take it better? We need to be able to use and do these things for the clients when we're providing care for them. Now, typically home health aides and caregivers and homemakers are not allowed to do the following when it comes to medications. We're not allowed to break apart or crush capsules or tablets. We're not allowed to mix the medications with food or drink. We're not allowed to pour or mix medications from one bottle to another. Okay, what they call marrying the medications. We're not allowed to touch the medications directly with our hands or their hands. We cannot assist with medication if the client's name is different from that on the label. And we can definitely not assist with medication whose label has been removed or been changed, or if the expiration date has also occurred. We also cannot assist with medications if medication name does not match the name on the care plan, okay? Additional things we cannot do is we cannot use appearance alone to identify a medication or not assist the client in taking more or less of a medication than is ordered. We also cannot and will not remove or change a medication label, and as well as any of the other things. And if it's an injection, we are not allowed to drop this solution for injection. If you're working with a client typically who is using, let's say, for example, insulin, okay? So here's more additional stuff. We cannot give the medication, okay? The client has to be able to do it on their own. Remember, it's not in your scope of practice. Now, we also need to look at the precautions when we are assisting clients with self-administration, though, okay? We need to report to supervisor if there are missed dosages. We need to be able to make sure we document the medications that are taken. We have to be able to pay attention and watch for those side effect symptoms. Are they occurring? Is there those nausea, the vomiting, the headache, the confusion, the dizziness, the drowsiness? Are they present right there? Now, how about the more serious symptoms, such as allergic reactions and hypersensitivity, like hives, fever, rash, especially difficulty breathing, because that's the last thing we want, because there could happen where they develop a allergic response to these medications, especially if it's a new medication that they're taking. We need to monitor that because that could put them at risk. So what are the signs and symptoms of side effects? We've discussed several of them already, but we're just going to be putting them in this slide right here to make things easily. Dizziness, fainting, nausea, vomiting, rash, hives, that drowsiness, the headache, the blurred vision, the abdominal pain, diarrhea, and once again, especially breathing difficulties, as well as swelling the throats or the eyes. Now, we need to report the following problems immediately. Okay, we need to report, hey, is the client refusing to take the medications? Is the client taking a wrong dose? Are they doubling up on the medication? Some clients or some patients think that they should just double up on the medications. The sooner the better. Client takes medication the wrong time. Client takes wrong medication for real. Medications container is missing or empty. We need to make sure that these are reported so that we make sure the client is being able to be cared better and properly. So if there's any medication emergencies, what do we do? Okay, so if there's allergic reaction and they're having problem breathing, okay, if it's severe enough, we need to call 911 or for emergency. We need to be able to make sure if the client took a wrong dose, okay, we need to be able to inform our supervisor, the manager, to be able to figure out what's going on right there. Were there any complications with the medications? If it's severe enough, call 911. And also at the same time, is there any overdose of the medications? We need to be able to call poison control. A lot of clients, a lot of patients are taking some, narcotic medications, and sometimes they may possibly take a little bit too much, and we need to be able to watch and monitor for signs of overdose of any medications, even in the senior population. If there's any emergency, especially if it's involving medications, remember not to give any additional liquids, any food, or other medications unless instructed to do so. and you just have to follow the poison control hotline. You give them a call, or you call 911 directly, and they'll let you know what needs to happen and what needs to occur. So let's talk about the different storage of medication. We need to understand the points about medication storage. You want to keep the medications in one place and separate from other people's medications. Now, if you're working with children or patients that are kind of disoriented or confused in the home, you want to be able to recommend that medications are locked and in a child-proof container. You want to make sure that you need to refrigerate any medications if it's necessary and place on a higher shelf. You want to be able to store away from heat and light. There are a lot of medications that should not be exposed to light at all. So the client, and not the home health aide, not you, not the homemaker, not the caregiver, should discard expired or unlabeled meds. And of course, do not dispose them on trash. A lot of cities have recycles or pretty much medication collection days, or you can also go ahead and just have them or suggest to them to put the pills in the toilet, and you can pour bleach on it and then flush it down the toilet. So we also need to look into signs of drug abuse, okay? And to know what drug abuse is. So to know what drug abuse is, it includes the following: refusing to take the medication. Why is that a drug abuse? It's because you were ordered medication and you're abusing it because you're not taking it. You're not taking it the way you're supposed to. So abusing a drug goes both as not taking it the way you're supposed to, or literally not taking it at all. Taking a wrong dose, taking a medication at the wrong time, mixing with alcohol. There's a lot of medication that has bad reactions with alcohol. A lot of the, antidepressants, a lot of narcotic medications have some bad reactions with alcohol. Taking drugs that have not been prescribed. Are you taking medications that was not ordered for you? Are you taking any illegal drugs in addition to the medications that are going to be given to you? Are you sharing your drugs? Are you, getting the prescription for them and selling it to another person who sells it for you or pays you money for it? So some of the symptoms or some of the signs or misuse of drugs or abuse pretty much is depression, anorexia, change in sleeping patterns, withdrawal, and moodiness. There's that secrecy, the verbal abuse, as well as poor relationships. So what are some of the reasons why clients may not take their medications? Well, several things comes up a lot that we see, especially in the senior community, is a lot of them don't want to take their Lasix or their diuretics because it makes them go to the bathroom and go pee. And because of that, they don't want to take the medications. But then that also causes problems because then they get congestion and then they cannot breathe. Okay? So those are some of the reasons why that occurs. So we want to be able to make sure that we educate the client on why they need to take their medications, why that medication was ordered, and that is the job of your nursing supervisors or the nursing team or the therapy. So make sure that you monitor these things and you report it to the proper people in your company. Moving on and understanding oxygen equipment, and remember, oxygen is considered a medication, okay? It's considered actually a medication in the nursing field. So oxygen therapy is the administration of oxygen to increase the supply of oxygen into the lungs. An oxygen concentrator is a box-like device that runs on electricity to change air in the room into air with more oxygen. And typically most oxygen concentrators has an attached water filtration device that adds oxygen into the air. A nasal cannula is that device that is used to deliver oxygen right into the nasal cavity, that consists of a piece of plastic tubing that fits around the face and two prongs that fits right inside the nose. So moving on, combustion and flammable. So when you're dealing with oxygen, we need to be careful. There needs to be signs outside the house so people know that when they enter that there is a chance of combustion or flammables in there. And oxygen is that and can cause that. So a combustion is the process of burning. Flammable means easily ignited and capable of burning quickly. Now remember, oxygen pretty much fuels flames, okay? So that's what it does. So if you've ever lit a candle, for example, and covered the top of the tip of the candle, covered the top of the container, eventually it will die out because it's burned out its oxygen. So oxygen literally helps the fire burn. And so that can cause problems. We need to be able to know the following factors concerning oxygen administration and your role as a home health aide, okay? So, oxygen therapy is always going to have to be ordered by a physician. The home health aide, the home caregiver, should never handle or administer oxygen. Now, here's one thing that we are doing. We may be administered, we need to understand that, oxygen can be administered in different ways. But what we can do is we can assist the client, for example, to, if they ask, hey, can you pass me the nasal cannula? Sure, we can do that for them. We can turn on the machine for them, but we can never adjust the treatments. So if they are supposed to be getting 2 liters, for example, we cannot be adjusting those. The client has to be able to do that for themselves. Okay, so we may be administered different ways, such as in tanks or an oxygen concentrator. So we talked about oxygen concentrator earlier on, where it's that electric device that's attached to the wall, to the electric socket, and then it takes the normal air and adds more oxygen to it. There's, it can be either delivered by a nasal cannula, which are those tubes that go straight into your nostril, or you can have one of those full-blown masks that goes over your nostrils and your mouth as well to be able to deliver that. And typically, if you're delivering it with a mask, the mask will have a bag that's attached to it, but you don't have to expect the bag to actually inflate. It can be flat the whole time, but oxygen is actually still being delivered. So additional roles that you have as a home health aide is to understand that oxygen supports combustion. So we need to be able to make sure that we post a no smoking sign, or one of those signs that says oxygen in use. Make sure that nobody's smoking in their room. If the client is smoking, suggest that they should not be smoking or have to be outside the house. Never allow candles, lighters, or matches close by. Do not use oxygen near any wood burning or gas stoves, any gas-based heaters, or even fireplaces. Never ever use an extension cord with an oxygen concentrator as well. Never place an electric cord or oxygen tubing under rugs or the furniture. Try to avoid any nylon or wool, because those create frictions and can cause a spark. You want to be able to report any skin irritation from the nasal cannula or face mask. Sometimes also understanding when you're having the nasal cannula, it goes around your ears. Okay, so sometimes you would have to put some padding between the cannula and your ears to prevent any pressure sores as well. Okay, never use those petroleum-based products on clients or any part of the cannula or the mask. Never ever adjust the oxygen unless there is a fire, then you can actually turn it off. Okay, here's additional guidelines for oxygen tanks. Okay, these are tanks that looks like you're going scuba diving or something. So these are tanks that are pressurized. So we want to be able to make sure that if anybody is using oxygen from oxygen tanks, we want to be able to record the pulse and respirations. And this goes anything if we're giving somebody oxygen anyways. We want to be able to look at the flow meter. Do we have enough oxygen in there to last? And we need to be able to pay attention if it runs out. Those electric oxygen condensers, those are a lot easier because they can last a long period of time until you have to replace the water. The tanks typically don't last that long, especially if you have a continuous flow of oxygen coming. You want to be able to make sure you change the nasal cannula on a good often basis. Okay, so change the nasal cannula when it is hard or cracked. And you want to be able to change it typically every 7 days. And then also make sure that the oxygen tank is always secure and it doesn't fall on the ground. Most oxygen tanks, when it's supplied to a client at home, they're given the stand for it. So you need to make sure that whatever gets used gets put back, and then the new one gets applied and gets placed into the tank itself. So we talked about oxygen concentrators, we talked about oxygen tanks. We also have new stuff now called liquid oxygen, okay? So it actually gets delivered to you in an oxygen. You can actually, they come in large tanks, but you can also refill portable tanks that comes with it if the patient has to go somewhere. So make sure that you do not tip it over. Make sure that it's in an open space. Never ever, use the reservoir as a storage where you put clothes on top of it. You put so many different things on top of it. Make sure it's clutter free. Okay, when you're lifting this, when you're moving it, always support it with 2 hands. And then at times, remember, this is liquid oxygen, just like think about those liquid nitrogens. They can get frosted really easily. So if it frosts up when you're trying to open it or when you're trying to adjust it, don't touch the area that's frosted, because the temperature drops a lot, and that can cause any burns for you, okay? So you need to be able to pay attention to that. Now, remember oxygen concentrators, we talked about that. You always want to make sure that the dial is set up properly. There's those humidifying bottles, make sure those are filled up with sterile waters. And if it's running out, make sure you either change the bottle or you refill it depending on what type of product it is. Okay, we talked about oxygen, we talked about some oral medications, some other medications. We also might get with a client that has an IV site. Okay, so you understand that as a home health aide, you never want to touch the IV site and never insert or remove IV lines. That is not in your job description. Okay, so you should never start or remove IDs, or I'm sorry, IVs, that is, intravenous needles. You always want to observe the IV site for changes and problems, and at the same time report it if the patient has one of those. You know, you need to report if the needle falls out, if the tubing disconnects, if the dressing is loose, if there's blood in the tubing, if the site is swollen and discolored, if the client complains of any pain on the site. If the IV bag breaks, there's no dripping. Let's say somebody started an IV tubing and it's not dripping at all, so that means it's not working, it's malfunctioning. Or if the client has one of those pumps that are beeping, make sure that's reported as well. So let's talk about complementary medicine and alternative medicine. Complementary is treatments that are used in addition to the conventional treatments prescribed by a doctor. And alternative medicine is practices and treatments used instead of conventional healthcare methods. Okay, so we need to also still touch bases on some complementary and some alternative health practices. Some of these would be chiropractic medicine, acupuncture, homeopathy, herb and dietary supplements, including massage therapy. And if you're in the West Coast, you're gonna see a lot of other therapies such as crystal therapies and other different things that are coming up left and right. So we want to be able to make sure we are familiar with what those are. Have you ever had experience with any complementary or alternative medicine practices listed on the previous slide? I'm sure either you have or you've heard other people who's had those. You should not make judgment on clients if they are using any alternative medicine practice or complementary practices. Okay? You just need to be supportive for them. This is a decision that they made on what they wanted to do for their care. So we want to be able to be familiar at least with all the different types of treatments and medications that a patient may be facing. From oral medications, from intravenous medications. And remember, we also touch bases on the oxygen. It's very important that we pay attention to be able to prevent any injuries for the clients. But most of the time is if you're a senior citizen, if you're a senior client and you're working in the home care industry or the home health industry, more likely you are taking medications as a caregiver yourself. You are going to be exposed to the patient and the client or the family members having to go through this. So we need to be familiarized with what we're going to be expecting.